The New York City Alliance Against Sexual Assault is really excited to present this webinar on engaging bystander in sexual violence prevention. During this 1-hour workshop, our guest speaker, Victoria Banyard, would guide us through a presentation on the history of bystander intervention model. She will talk about some of the key concepts that inform bystander behavior and also highlight research findings on the effectiveness of this model. So for our webinar today, as you all noticed, we are using ReadyTalk technology. So please make sure that your computer is compatible with ReadyTalk software. You might be asked to install the computer plugin as you log into ReadyTalk, which means that you might see a pop-up box on your screen. So just press OK and you will be able to run the presentation on your computer. If you are already signed into ReadyTalk, please remember to dial in the number that you see at the bottom right-hand corner of your screen for audio. Okay, so a little bit about who we are. The Alliance is a center of excellence in primary prevention, specializing in sexual violence prevention. At the Alliance, we envision a city free from sexual violence, and so the Alliance is actively working in our communities and is doing a lot of prevention work through sharing resources, technical assistance, and training statewide to build capacities of organization and our partners to advance social change movement to end violence in our communities. You can visit our website as svfreenyc.org to access our prevention newsletters, resources, and blogs. And we also encourage you to sign up for a digest for the latest information on webinars, both local in New York State and nationally, conferences, prevention resources. We have all of that on our digest. Okay, so we do have a few quick tips about the logistics and how you can participate on this call. Being mindful of your busy workday, we have tried to keep this webinar to an hour. So we do have a very, very tight agenda for our call today. So Victoria would use about the first 45 minutes to present on this topic and then address your questions at the end. However, we do encourage you to keep sending us your questions and comments in the text chat box that you see at the bottom left-hand corner of your screen. So keep sending us your questions, and if we can address the question midway or halfway through the presentation, we'll try to kind of address it as we get some of those questions. And if we are not able to, we would try and address them at the end. So we'll make sure that we answer all your questions. Also, for those of you who want to review this information later on or would like to share this webinar with your peers, please know that we will have a recording of this webinar available on our website a week from today. So this webinar will be available on YouTube and also on our website. Okay, so the big question that I have been getting from a lot of programs that I've been in touch with is, why did we pick this topic? So to kind of roll back a little bit and think about that, I've noticed that as preventionists and also as a care provider, we found that whether you're working with campuses, neighborhood communities, or in school settings, we all kind of agree that active bystanders play a valuable role in sexual violence prevention. And in the last few years, and more specifically with the recent focus on campus sexual assault prevention, we have found that more and more practitioners like us are integrating bystander intervention model into their prevention work. So we have like smartphone application, curricula, community engagement model, all of that we preventionists are using in order for us to engage our community as proactive bystander. So with that, our hope for the webinar today is to answer some of the big questions we have been grappling with in the field. And today, by the end of the webinar, we hope to learn about a little bit about the history of bystander intervention, some of the concepts that inform bystander behavior, the ways in which bystander intervention model can serve as a useful part of a broader community-based approach, which we feel like all of us we are trying to work so hard mobilizing our communities. And I feel that models like bystander intervention, framework can be so easily and meaningfully applied to whichever community we are working with, be it the neighborhood, the school, or the campus community. We also would find out some of the information about bystander training tools and hear from Victoria on some of the current research on how effective the strategy is. So with that, I do want to introduce our guest speaker, Victoria Banyard. Many of you are already familiar with her work on bystander intervention model. Victoria is a professor of the Department of Psychology and Justice Studies at the University of New Hampshire. And she's also a member of Prevention Innovation, which is a research group focused on bridging research and practice to end violence against women. Victoria has also worked with trauma survivors as a psychologist, taught numerous courses on violence and on community psychology, and she also has a program of research that centers on understanding violence against women. So that's a lot of comprehensive work that she's been doing in the past many years. She's also published many articles on bystander intervention as a model prevention program to violence prevention, and has received several federal grants to evaluate bystander prevention programs on college campuses. She also has a forthcoming book on bystander action to violence prevention, which will be out early next year. So please watch out for that. And with that, I really want to welcome you, Victoria. Thank you so much for being here today and sharing your expertise and knowledge and research work with us. So welcome.
Oh, well, thank you so much. It's nice to meet all of you virtually, and really an honor to be invited to do this. So I'll try to make the next 45 minutes as useful as possible, recognizing that there's probably quite a bit of diversity of learning goals out there in the audience. So just to get started, I think one of the common things that probably brings us to this topic is our passion for ending sexual violence and our recognition that really it takes a village. It takes a whole community approach to do that prevention. This is one of the traditions on my campus, which is that late in the summer when all the first-year students come in, they all go on the main lawn with the president and his family and get their picture taken. So this is a snapshot of part of the community where I work. And now I would actually like to learn a little bit about the community that's present on the webinar today. That helps me understand a little bit more about who you all are. So this is a quick polling question that we ask you to use on the Ready Talk conference to just answer, so we can all get a sense of who's on the call today, which is really helpful. So appreciate that. We'll just give everybody just a minute or two to weigh in on that. Right, and it looks like we have quite a diversity of folks who are on the call, people representing a variety of different kinds of agencies, campus-based, community-based, and I will try to address my remarks in a way that will apply to everyone. So we have one more polling question, which is just to try to get a sense of whether or not your program is currently implementing some form of bystander engagement approach as a prevention strategy. All right, and that's very helpful. It sounds like most of the folks on the call are using bystander action, bystander intervention in some way. So, so we'll use that as a starting point, and hopefully you'll find some things that may enhance some of the work you're doing. Also, some folks who are not yet using that strategy. So we'll also try to provide some helpful information for those folks. Okay. So we'll just start really briefly. Again, the word bystander is somewhat of an imperfect word, but it is one that's been used, I think, throughout history, been the concern of politicians, scientists, activists, philosophers. There are just a couple of quotes that I put on here of some pretty famous folks who speak about the issue of people who have a chance to witness people who need help, whether because of an emergency, a criminal event, or some kind of situation like that. And others are present as witnesses and have the opportunity to step in to take action to have a better outcome happen, or to do nothing, or in some cases, particularly as we see in the bullying literature, to potentially make things worse. And of course, in sexual violence prevention, we're very interested in the idea of pro-social or active bystanders, people who intervene, step in ways that can influence the outcome positively. And I think we see a lot of different terms that get used: upstanders, bystanders, active bystanders, witnesses, defenders. So they come by lots of names, and I think if we could find a really catchy, motivating name, that would be great, and maybe one of you will come up with that, because that would be really helpful. I also think it's really good to just talk about how when we talk about bystander behavior, I'm really talking about a whole variety of things, that there's not just one kind of bystander behavior. It's going to depend on the situation, the community context. Some bystanders may intervene more close up or more distantly by calling in helpers. Some people may intervene with others or intervene alone. And this is a diagram that we often use in our own prevention programming to help people and community members really think about all the variety of different options and ways that they might step in. So I wanted to spend just a few minutes talking about why a focus on bystanders. And again, this is something that may be more familiar with for some of you, so I won't spend too much time on this. But I think that a big piece of this is that across the prevention spectrum, what we really do understand about sexual violence is that community and peer norms are certainly very much risk factors for this behavior. We know from criminology research that one of the pieces of what makes a crime like sexual violence more likely is what they call the absence of capable guardians. So you certainly need to have a motivated perpetrator, and you need to have someone who is available as a victim, but then it's also the absence of other people around who might interrupt what's going on that also can lead to criminal behavior. I think there's also a growing interest in trying to mobilize wider community response and social change around this issue. We're certainly seeing that with a lot of the national conversation around campuses. And also the recognition, certainly, that in terms of improving our safety nets for survivors, that the vast majority of them don't necessarily contact professional helpers. And even though we might want to increase that number, that in the meantime, there's also many, many, many survivors who are accessing their informal support networks. And we know from a lot of research that the reaction they get from those friends and family makes a really huge difference in terms of the impact of the assault and their long-term recovery. And so if we can also help and think about those friends and family as potential bystanders who are in a position to provide those supportive safety nets for survivors, then we can also be really improving comprehensively our community response to this problem. I also want to present this, and this is a little bit of a messy graph, so you'll have to bear with me because I'm a little bit of a research geek, so I have to kind of get one of my little messy tables in there. But it has a fairly simple take-home message. This comes from a study that I did with several colleagues where we surveyed a lot of different community members about their experiences of victimization, and then from the perspective of being a victim, whether there was a bystander who was present when a variety of different forms of victimization happened, and the different colored lines just represent different forms of victimization. And the real take-home message here is that mental health and better mental health among victims was reported for those who had a helpful bystander, so that the left side of the graph is higher than the right side, and really showing that bystanders who step in to help are making potentially a big difference for victims. So another piece of evidence that bystanders are an important piece of the solution. So to the crux of what I was asked to talk about today is really then how do we promote positive bystander action? And we've really had a variety of research over the years, starting with, in fact, close to home for all of you, with the case in the 1960s of the assault and murder of Kitty Genovese, where many people witnessed what was going on, and it took a very long time before anyone called police or engaged in any kind of bystander intervention. And that was really the start of social psychologists being interested in saying, well, why is it that more people didn't do something to help in this situation when it seemed that people were aware that something was going on? And so since that time, there's been a lot of research that's really tried to look at what are some of the things that make it more likely that someone will provide help. And this diagram that I've made is a little bit of a picture of what the research is telling us at this point about helping in general. So that certainly people need to notice the event and see that someone needs help. Importantly, people need to assume responsibility, that they are a person who can step in and provide some of that assistance. And we know from some of the more recent research in sexual assault that empathy for victims, that social norms about helping, about stepping in, about whether something is someone's business or not are important at that particular point, about whether someone feels a sense of responsibility. That certainly there are pros and cons and important evaluations of their own safety that bystanders need to consider. Bystanders need to think about the confidence that they have. How confident are they that they can do something that will be helpful? To what extent do they have skills or experience that they can draw upon? One of the ways that I like to think about this is that psychologists often talk about behavioral scripts, that in social situations we often have a script of how we're supposed to behave, of how we're supposed to act. You know, if you think about someone who's experienced a loss, or someone who has experienced the joy of welcoming a new family member, we have rituals, traditions, and scripts about what we're supposed to do in those situations that are particular to our communities. And the question is, to what extent do we have those scripts for helping in relationship to sexual violence? And to the extent that people have those skills, that they have those scripts that are at the ready, they're probably more likely to step in to help. And then we certainly want people to have options, because we also recognize that every situation is unique and different, and sexual violence situations are complicated. And so there isn't just one magic bullet, one skill that we're trying to teach people, but that we want them to have a range of options that they might be able to choose from. And what I'm going to do right now is kind of break down a few of those things and try to give you an example of how, at least in the work that I've done with colleagues here and on campuses around the country, about how we've tried to apply some of the principles from this basic research where our understanding of bystander behavior comes from, how we apply that to situations of prevention. And if you want more information about the specific practical tools that I am offering, again, if you can go to Prevention Innovation's website at UNH, we have a lot of tools, and my colleagues who do more of the prevention implementation work would be happy to talk with folks. So as I was saying before, the awareness and knowledge piece is really the gatekeeper piece, and the quote I have here is actually from a student in a study that I was in where, I just didn't know if it was my place, I didn't know what the procedure was in a situation like that. So do people acknowledge that this is something that might be problematic? Do they notice the risk factors? Do they define the situation as a problem? And we know in our sexual violence prevention work that some of those definition and awareness issues are in fact the first big piece of challenge that we have to work on. And that we really need to work on community norms that support helping and stepping in. We have some. I was just at a conference over the last couple days, and some folks were presenting some new data about peer norms and how that can really impact people's perceptions of situations and whether it's appropriate for them to step in. So on our campus, one of the things that we do, some of my colleagues have developed a social marketing campaign called Know Your Power, and we actually had a grant a few years ago where we were actually even able to put the posters on the sides of the campus buses that really modeled, in this case, an empathy poster where friends are modeling supportive responses to a friend who comes forward to indicate that they've been assaulted. Sense of responsibility is also something that we find. I've done a number of studies looking at bystander behavior and intention to intervene in terms of sexual assault, and sense of responsibility is also important there. And that really has to do with things about perceptions of the victim, whether you see the victim as part of your in-group or not makes a difference there. Again, social norms that go against sexual violence, that support helping, can be really important in increasing a sense of responsibility. And as we know from some of the classic bystander literature, larger groups tend to reduce the sense of responsibility, except if those are friend groups. So that's one of the things that argues for perhaps doing bystander intervention training in social groups that already know each other and spend a lot of time together, because that may help work on some of the norms change. And just some examples from our work in terms of how we try to increase responsibility. We actually have a bystander pledge, which we ask people to read and sign at the end of their participation in our workshop, so that they really consider themselves having been asked to step in and to try to find some ways to respond in some positive ways to the problem of sexual violence. We also know that it's really important and that bystanders go through a process of kind of weighing costs and benefits when they're thinking about stepping in, personal safety being a really key and important piece of that. We know that some of the things that I just talked about can be real barriers if people don't have an awareness of what sexual violence is. We know from some of the national polls of young adults that have been done recently that many say they don't really recognize the risk or warning signs of sexual assault or relationship abuse, and that they don't really know what they might do in that situation. We also want, and so a way to try to address that then is really to try to build confidence and skills. And so many of the bystander programs that are out there, and perhaps many of you are already doing this, really try to build in a skill building component. And so we're trying to increase people's efficacy, and we know that that confidence really increases when they're actually able to be in a situation. I was actually, this conference that I attended, there was someone who was talking about his research about actually using virtual reality to try to increase skills, which is probably a very resource intensive and not very realistic community-wide, but was kind of interesting in thinking about technology. We can also think about role models and not just the obvious campus leaders, but if we think about the variety of different leadership in our community, whether they're spiritual leaders or what have you, but training them in so that they're modeling this, because that can be another way of promoting that kind of confidence. In our own work, modeled on work by other bystander programs, including the Mentors in Violence Prevention and other great foundational programs like that by Jackson Katz, we do use scenarios. So these would obviously need to be unique to your community, and when we work in different communities, we revise these. But it's to try to give folks a chance to discuss and role model what they would do in different situations, as well as how they would keep themselves safe. We also give them our ABC cards, which is just and when you think about some of the apps and things that are coming out now, like circles of safety and things, there are obviously ways to leverage technology. This is a relatively low-tech way of doing it. This is a little wallet-sized card that we give them that just reminds them of how to be an active bystander who cares, and it gives them the local emergency numbers, gives them some questions for checking in with themselves before they take action, and then gives them, in collaboration with our Rape Crisis Center, we came up with a list of some potentially safe interventions that they might try. But what I want to put forward, so that's really what we know from the research so far about bystander intervention. And I will say that a lot of that research comes from, not from sexual assault and from domestic violence, but more from just helping in emergencies in general. And so what I want to say now is that I think that there are some particular complexities when we think about sexual assault that means that we need to be doing things perhaps a little bit differently. And I'm not sure that I have a lot of answers to present to you today, but I guess I feel like you are the audience who's going to come up with the answers in your work, to be thinking about how do we address these kinds of things within our communities. So one of the complexities is I think there's different kinds of helping, so that certainly I think bystanding is not just one type of behavior, right? It can happen before, during, and after. I mean, before you have issues of harassing comments that may be being made, and so we want bystanders to be more the dissenters, the people who are expressing disapproval or not going along with those kinds of comments. Those are really different intervention strategies and may receive very different consequences from your audience than, say, when you're in an at-risk situation where we're hoping that bystanders will be defenders, that they will be interrupters of those risky situations. In those situations, we may be considering things like the physical safety of bystanders and things like that. And then we can think about being supporters afterwards to survivors who may come forward. And so I think we have to recognize that there are lots of different situations that bystanders are in, and so we may need to do skill building across those different kinds of situations, because there will be different barriers and challenges, as well as different things that will promote helping in those contexts. We're also starting to learn a lot about how helping friends versus strangers is really different, and whether you know the victim or the perpetrator or both of them. And so in some ways, if you know the people involved, you may feel safer to step in, but if you know the people involved, you also potentially have some potential for retaliation or repercussions on the relationship and friendship that I think bystanders are telling us they're thinking about when weighing whether they should step in. I think that gender is also an issue. I think it's a whole other separate webinar. We do know that gender norms across different communities do affect the kinds of helping that people choose to do. We also know, again, which I think is an important topic, that the position of the bystander, so that my colleagues have done quite a bit of work in the LGBTQ community. We have considered issues of marginalized and relatively disenfranchised groups and communities, and there are different challenges and barriers certainly to being a bystander if you're from a more marginalized group in a community than if you're not. And particularly the research in the bullying literature, for example, does talk about how if you have higher social status, it's much more likely that you will be an active bystander, probably because it's a lot easier to do so and you're much less likely to experience some kinds of negative repercussions. So this is another data slide, but this just, I think, reminds us that the consequences for bystanders are real. And this comes from the same study that I mentioned earlier of several thousand, a community sample of adults in the South in the U.S. And again, we asked victims about the presence of a bystander during their victimization experience, and we asked from their perspective whether they felt like the bystander had also been harmed or threatened during the incident, or whether the bystander was safe. And I think, again, the take-home message here is that the right side in this case is higher than the left side, and that basically having bystanders who victims felt were safe was associated with better mental health status than perceiving that bystanders had also been threatened or harmed. So I think what this says to us is that not only do we need to be thinking about bystanders because they're thinking about their safety, but that victims are also thinking about the safety of bystanders, and to the extent that bystanders step in and are themselves threatened or harmed, that can also have further negative consequences for victims and survivors in terms of how they're moving forward and thinking about what's happened to them. So I think it is really real that we need to be thinking about these safety issues. So the way that I think about this then is the model that I gave you all before just a few minutes ago was very much a linear model. You know, it was sort of step 1 to 2 to 3, and you kind of move from one thing to the other. And that's really how the field of social psychology has talked about this for a long time. But the more time I spend with survivors and with bystanders and talking with them about their experiences and doing surveys and trying to gather data about this, the more I feel like that really doesn't fit what the experience is for bystanders to sexual violence, and that really what we need to be thinking about is what I call action coils, and I talk a lot about in my book, but some of the basic messages of this are that I think we need to think about feedback loops and spirals instead of steps. Because, for example, what we know is that people are much more likely to help their friends than to be helping a stranger. And when you help a friend, it's often not a one-time event. So even if a sexual assault happens only once, your friend may be dealing with that as a survivor for quite a while, and there may be multiple points at which you have to revisit kind of helping. Even within an assault situation with a stranger, some of our community members talk about trying different things. So how they might have gone up and said something and been sort of brushed off, but then they went back again and then ultimately maybe called in professional helpers, and they had to try a couple of different things before the situation was resolved. And so I think we need to be thinking about that. I think we've also done too little to understand what consequences bystanders may experience and how they may experience some negative retaliation, and how if you're trying to be a bystander once and it doesn't go so well, how that may make it harder for you to step in the future. So how do we train people and really have conversations about that within our prevention education? And that's the piece about consequences mattering, people learning via experience over time. Certainly our community members have said that experience over time has been very important in terms of their skill building, and I think that really supports the need for us to advocate for more resources for prevention over time rather than these sort of one-shot, one-time kinds of things. I think we also need to think about context, what I said earlier about the position of the bystander, how much access to power they have and social status in the community. We know that collective efficacy and trust in authorities is really big. Even on campuses, there's been some preliminary research that suggests that students who trust in campus authorities and trust that they care to do something about problems are more likely to report instances or concerns about threats of violence or those kinds of things. So the attitudes of leadership make a difference. Whether a community has amnesty policies on campuses, it's very relevant related to underage drinking, but what are the kinds of policies that may protect or serve as safety nets for bystanders? So I think we need to be thinking about those kinds of things, and those things really take us beyond just thinking about bystander as about individual change. It's really about also changing the community context. And here's just a sketchy picture of kind of what I think about as the spiral of bystander action. That really it's about decision making in the moment. It's about some of the complexity that I just talked about. It's about what's going on in the event. Who do you know? Where are you? How readily available are other people to help? And then also it's about the outcome and what happens when you step in, and that all of those things are looping back to each other to make it more or less likely that you're going to be stepping in the future. So I will do this last part of the webinar. I realize we've kind of done quite a bit. And some people are saying, has the Kitty Genovese story been revisited? It has. I will actually say that it has, and basically it's been revisited in terms of that there were not quite as many bystanders. I think at one point the legend was that there were like 40 people or something. It's now been revised, and some people have actually taken a really close look at the court records and police reports and things, and they actually think it's probably more like 8 or 9. But I think what happens is that's sort of the beginning of the bystander research, which is why I bring it up. But I think we only need to look to Steubenville or the California Richmond, California case a few years ago. I mean, we see this happening and playing out over and over and over again. Though I think it also reminds us that our media is very quick to pick up on these negative bystander stories, and it would be nice if we could find a way to change some norms by starting to highlight positive bystander intervention. So where are we? I'm going to present a little bit of data from the work that I've done on program evaluation, but I feel like I would be remiss if I didn't start by just giving an overview of the variety of programs that are out there and sort of where we are and where we need to go. And I think at this point we're seeing a real variety of audiences reached. Certainly college campuses are probably the place where much of this has been happening, with incoming students, with athletes, with Greek members, with student leaders. We are starting to see middle and high school student programs doing this. We are starting to see some community programs in Washington, D.C., Arizona, and Boston. We see the Safe Bars sort of movement about training bartenders to be active bystanders. Stop It Now is doing work around child sexual abuse to try to mobilize community members related to that issue. So I think we're seeing kind of an expanded view of where people are doing this work. We see a variety of prevention methods, social marketing campaigns like posters, interactive theater like iScream and Interact, online curricula, educational workshops, some parent-based work that's happening. I know of one evaluation that's been done by Maria Testa for parents of college entering students that tries to help parents have conversations with their college-bound students about issues of sexual assault and alcohol use and those kinds of things. I'll say one other thing about parent-based as well is that, which I think also argues for this broader community approach, there's a really interesting study that just came out. It's just been published from the National Youth Victimization Survey, NATSCEV, and in their last iteration they included some questions about prevention. And they were able to create a little composite of the quality of the prevention and look at how it related to outcomes like victimization and things like that. And what they found is that the indicators of higher quality prevention, meaning and this is sort of youth, not young adults, but that prevention programs that had some kind of parent component, whether it was a parent workbook or parent involvement, workshops that were more than one time, that included some kind of skill building rather than just lectures, were found to be more effective. And these are across types of prevention, including bullying, dating violence, those kinds of things. But I think it does remind us that going in some of that direction to caregiver-based and community-based is really important. And then, of course, social media and apps. So now we have another poll. Give me a chance to catch my breath and maybe you all to think about some other questions. And hopefully there was a model about examples of how you've seen this model play out. And those are all the examples that I just gave you all were mostly from college campuses. I think we're starting to get some data. The Shifting Boundaries program that you all probably know about because it took place in New York City does have a bystander component, and that does have some evaluation, though they mostly find positive results for the school-based policy change kind of work, and I'm not really sure how much they evaluated bystander behavior as an outcome. The Coaching Boys to Men project, which trains high school coaches to be trainers and to teach their athletes about sexual violence, gender-based violence, dating violence prevention, has shown some real success in terms of changing behavior. And so that's a high school curriculum. So I think, and I'm going to talk in just a few minutes about what we know about the efficacy of or effectiveness of some of those things. But all of those are examples of curriculum and programs that are out there. The Know Your Power, some of the apps that are starting to show up, though they haven't yet been evaluated. So looking at what types of prevention approaches or methods folks are using, again, we see educational workshops, social marketing campaigns, social media, some parent and community-based leader work that's great. Theater is wonderful. At this conference where I just was the last couple days, I actually saw a presentation by folks from Rutgers who've been evaluating their ice cream theater with some positive results online. So again, folks using all kinds of different modalities, and I think what we need to do is try to understand a little bit more about what are some of the foundational successes there and how we need to combine these, because I think what I find most exciting about these different modalities is that we have the chance to combine them so that people get the message more than once. Okay. So what we see across a number of increasing evaluations, and again, more of the evaluations are taking place on college campuses, but we're starting to see some like Shifting Boundaries and Coaching Boys to Men that are in high schools and middle schools, is that programs certainly seem to have an impact on attitudes and behavior, so that we are increasing people's sense of responsibility, we're increasing their knowledge about sexual violence, we're increasing their confidence, but that we do need well-trained prevention educators. We need multiple exposures, so longer programs tend to show better effects, so that's not always the case. So we have a little work to do on that, and I think some of the data that's going to be coming out over the next year or two is going to help us think through that a little bit more. I mean, Coaching Boys to Men, for example, is a relatively short intervention, and some of my colleagues who've been doing evaluation on social marketing campaigns have found that they've seen some effects, particularly in shifting that sense of responsibility and awareness piece, not necessarily the skill building, but specific effects do seem to produce larger effects. So we found in our research that we tend to see somewhat larger effects for women than men with bystander effects, but do see that the program works for both. We do find across studies that effects tend to decline over time, which suggests to us that we need to keep getting these messages in new ways in front of our communities, and that boosters can really help preserve the attitude change and potentially the behavior change. And I'm going to present a little bit of data that also suggests that some of these bystander programs are changing the number of bystander behaviors that people are doing. There's also a little bit of data from some evaluation of Alan Berkowitz's men's project that suggests that for some groups of men, the program, the social norms bystander curriculum can be helpful in terms of sexual violence. The Coaching Boys to Men evaluation is showing those kinds of behavioral effects, which is ultimately what we really want, because attitude and knowledge change is fine, but ultimately we really want the violence to end, and that's behavior change. So I'm just going to take just a couple minutes to provide you with just a little bit of data that's come from where I work and some of the grants that we've had to look at the evidence for bystander intervention and does it work. And I know that this will be up on the web, so people can go back to this. People can also feel free to email me, though the easiest way to find all these citations is to go to the Prevention Innovations website. But these are just some examples of the research studies and the publications from which the results I'm going to explain to you all have been drawn today. So this is from one study, and one study was funded by the National Institute of Justice and the other for the funded by the Centers for Disease Control and Injury Prevention. So this is one study that we did about 10 years ago now, and what you see is that the red lines are the control group. They were not exposed to anything in particular. Then we have blue, which is our one-session, 90-minute bystander prevention program, and the green, which is our 3-session bystander prevention program, which is about 4.5 hours long, split over 2 to 3 sessions. And what you see is real changes over time from pre-test to 2 months in the blue and green for knowledge, for helping intention, and also for bystander behavior. And all of those are significant. I think one of the things that's really interesting in the bystander behavior is that you notice that the 1-session folks have higher bystander behaviors than the 3-session folks. They are both higher than the control group, and that can raise some interesting questions. I think that the research suggests that we still have some work to do in measuring bystander behavior, and that one of the complications in doing that is the issue of opportunity. And one of the things that we kind of wonder about is whether or not being part of bystander intervention programming makes people make different choices about where they spend their time, whether it changes peer norms so that they're not potentially having as much opportunity to be an active bystander. And so that would then affect the level of bystander behavior that you see. So it's just kind of interesting to think about that. One of the other ways that we tried to look at this was we tried to look at how much improvement, and we also tried to look at whether there were any people in the groups who got worse. So trying to make sure that our prevention program is not harming people, sort of a backlash effect. And so this is just another way of presenting what I was just describing to you. And what you can see is that the dark blue bars are the control group, and you're not really seeing any great percentage of those folks improving in their scores on either rate misacceptance, and we scored that so that it better scores are better, even though we want less rate myths, and that's what that's indicating there. But confidence to intervene, intention to intervene, or their behavior. And so the take-home message is really that the lighter blue bars are higher than the control group, suggesting that over time the folks who were exposed to the program are showing some changes. And again, because it was a randomized experimental design, we're fairly confident that what's driving those effects, at least in large part, is their participation in the program. These lines come from a different study that we did, and just to make sure everybody's awake at this point in the afternoon, I've changed the control group is now blue and the program group is now red, so it's now different from the other two. So apologies if that's confusing, but and basically this is looking at, we had follow-ups in this study up to a year later, and these are attitude measures, but what you can see is that those who experienced both the in-person education program and a social marketing campaign are doing much better on confidence, on responsibility, awareness, and intent than the folks who got the social marketing campaign only by 12 months. So at post-test, nobody had gotten the social marketing campaign, but at 12 months, everybody in the community had seen the Know Your Power campaign, which did have effects on knowledge and sense of responsibility, at least in the short term. But the program group had some additive effects. We didn't have a true control group in that way. So finally, I just want to leave us in the last couple minutes before we take some time for questions to talk about some complexity. And one of the questions that's come through, I think, is what makes a bystander approach different from other primary prevention approaches. And so maybe I'll just take a little bit of a tangent to say that, and then we can talk about some of the complexity in a bystander approach. I think what's different is, and people have argued about whether it is truly primary prevention, because a lot of bystander intervention is potentially in risky situations where risk is already starting to escalate, and certainly some bystander intervention is happening after survivors come forward to try to support them. But I think the potential is that that people can interrupt situations before the violence happens, and of course that's very hard to measure. But I think it's different in that it really gives everyone a role to play. So I think that historically, and we even see this in our community, there's still a fair amount of stereotyping of sexual assault education as being about risk reduction for women, and men feel very much like if they take a seat at the table, they're going to be taught how not to be perpetrators. And even though we know that that's not really what prevention is doing right now, I think that bystander intervention, first of all, gives everyone a seat at the table that everyone can really see themselves as wanting to be in, because who doesn't want to help a friend? Who doesn't want to be an active community member if you can do it in a way that's safe and in a way that is supported by your community norms? I think it also goes beyond, ultimately primary prevention is keeping perpetrators from engaging in that behavior. But I think that prevention has to happen very early on, and has to happen with a lot of the early risk factors that we know are associated with perpetration, including their own victimization. I think it also involves criminal justice and community responses that deal with perpetrator behavior once it started to happen so that it doesn't happen again. I think that bystanders can play a role as part of that prevention solution, because I think that, again, what we know from studies of perpetrators is really that community context helps to fuel and helps to camouflage what they're able to do. And so to the extent that we have bystanders who are not doing that and who are helping make visible what's going on and escalating risk and those kinds of things, that we may be seeing some positive prevention there. And so I think it is very much a proactive, get involved. You don't have to, that it's a little bit different from what some other approaches are doing. So hopefully that's answered the question that folks have, and I'll try to. I know we will have some more time at the end of the webinar if that wasn't a sufficient enough answer, and there are other things, and would welcome other folks to chime in on some of the ways that they've found bystander intervention operating somewhat differently. I guess I liken it in a way to when people talk about public health approaches and they talk about trying to change the situation rather than trying to change individuals. So if you think about an intervention for speeding, okay, so if there's lots of accidents that are happening on a particular stretch of highway because people are speeding, you can try to do education and public service announcements to get people to drive slower. But you can also change the road. So you can also get rid of the trees, make a wider median and a wider emergency breakdown lane, so that if you can, if you're worried about people falling asleep at the wheel, you can make those noisy gradations on the pavement so that they'll hear if they start going out of their lane. So I think public health folks have really been thinking about, how do we also think about changing the situation to try to decrease the opportunity for these problematic things to happen, a problematic outcome in the driving cases being auto accidents. And I think, when you look at the criminology literature about how does sexual assault happen, we ultimately do want to change the behavior of the people who are perpetrating these crimes. But to the extent that we can also change the context they're in, the situation they're in, and bystanders and peers are a big part of that situation, then maybe we can make it we can create less opportunities for these sorts of things to happen. So a few pieces of complexity that I would just want us to look at before we open it up for other questions are really thinking about evaluating complexity, and I think that we need to ask what happens when we translate to another campus. In my own research with my colleagues here, we have started to do that and found that while bringing in the bystander, the program that we've evaluated, did show some effectiveness on a very different second campus than our own, the effects were smaller and didn't persist quite as robustly over time. And so I think we do need to talk about, there's a lot of important conversation in the field about evidence-based, and a piece of that is certainly using programs that have a track record and show some effectiveness, but they have to be tailored for the local community, right? Because if people can't see themselves in the program, if the scenarios aren't realistic, if the options that they have to discuss, if the social marketing posters or images on the app don't look like the people that they hang out with or use their language or fit with their community norms, then it's really not going to be very effective. And so I think we can learn a lot from other areas of substance abuse prevention and HIV prevention and a lot of other areas that are a little bit further along in terms of some of this translation, to think about what are some of the kinds of things that we can do to make that translation. And again, on our website at Prevention Innovations, we have a number of publications and things that my colleagues have written that are about translating, particularly social marketing campaigns. We also know that one prevention program does not work for everyone. So our own program, for example, when we looked at bystander behavior, we found that our program was more likely to change people's bystander behavior if they already came in with a pretty high level of awareness. So our program tended to work for folks, but for some folks who came in without very much awareness of the issue, mostly what they got out of the program was that they had more knowledge and awareness. The folks who already came in with some level of knowledge and awareness that this was an issue and that they needed to take some responsibility for it were then grabbing from the workshop some of the behavioral skills that they were able to put into practice. So I think it reminds us that we need to think about that variability and how do we try to address it in the work that we're doing. I think we also have to understand, as I said earlier, a lot more about how our prevention tools work together. How can we put together online, with theater, with social marketing campaigns, with apps, with workshops, to maximize our use of the limited resources that we all have. I think we also need to ask some next questions, and these are things that I'm looking forward to all of you solving, and maybe some of you have, and I welcome you texting into the chat or emailing me later some of the solutions you've come to. But we need to understand more about developmental sequencing. So I think especially as more bystander work is happening in middle and high schools, how do we then capitalize on that when they come to campus? Are there ways in your communities, especially if you are community crisis centers, that you may be working with middle and high school students, and then maybe many of those students are even attending, if they are college attending, then maybe they're going to schools that are still part of your catchment area. And are there ways that you can design prevention that they may be able to be exposed to that is really interconnected across those developmental time points? How do we connect bystander intervention to other kinds of things that we need to be doing? Certainly training bystanders is one piece, but we need to be thinking about policies. We need to be thinking about what kinds of messages leaders in the community are sending. We need to be thinking, there is a place for risk reduction and other kinds of things that may be helpful. So I think it's one piece of the prevention toolkit. I don't think it's the magic bullet that's going to solve all of the problems. I think we also need to understand more about what are some of the essential elements. There are lots of things that bystander programs have in common. We don't really know which of them are driving some of the promising effects that we're seeing, so we need to understand a lot more about that. We need to understand what is a sufficient amount of information and dose of prevention programming for people to really be able to use it. Certainly in my work on college campuses, a huge issue is how we reach our audience. So, how can we get into classrooms? It's increasingly difficult to get our prevention work in front of people, and I think we need to work together to figure that out. So lastly, I just have a couple of slides that just show this kind of layering. And this is both thinking about how we might layer bystander training across years in college, but we can also think about how we can do it across the lifespan. And I think many of you are in a position to do more of that kind of layered prevention, which I think the field really, really is in need of. So that's pretty much what I have, and we have still a few minutes for questions, and then I leave with a quote from one of my favorite books that I always make my students read, which is Jonathan Kozol's most recent book, which I know is centered in a part of the world that you all work in, but some of the hopefulness in his book Fire in the Ashes, and I think it just reminds us that the task is big, but as long as we're all working on this together, we'll make some progress.
Thank you so much, Victoria, for that. That was really interesting, and all of that information that you packed in the last, 50 minutes is like wonderful, and thanks for that. We do have a few questions that are already coming in, and I also want to encourage our participants to start like typing in questions that you have, or anything that you have in mind based on the last 45 minutes or so of the presentation, or anything you face as you are implementing some of this bystander intervention strategy in your community. Many of you I know are working in the community, in bars, and trying to train bar staff and bartenders to kind of implement some of the strategies in their nightlife community. Some of you are doing that work in the campus setting, or some of you are just exploring. So this is a chance for you to ask some of those questions that you anticipate or are experiencing as you're trying to reach out to the community. I do have one question that I want to start with, Victoria, if it's okay. So how does bystander intervention model address some of the challenges to bystander action? Like, we have seen that oftentimes community members are pretty hesitant trying to intervene. And I know you talked a little bit about that. And oftentimes, especially this is very true in terms of bar and restaurant and nightlife community, where when we try to reach out to that community and train bar staff and bartenders on a really busy night, we have heard bar staff talk about like, oh, that's none of our business, or we don't want to get into our business, or we don't want to intervene. And there's always this question about, are we doing the right thing, or should we intervene? So how does this model kind of address some of this question? And I do want to add, in some of the culture-specific setting, because it's also a question about, you talked a little bit about this, like who you are intervening with and how are you related to that person. So if it's a community member that you know very well, you have a good relationship, and then you notice something, and it happens a lot on college campuses with youth from many, I know that it happens in the South Asian immigrant community, when one youth sees something happening to the other one, especially from the same community, they do not feel comfortable, or they're not sure how to address some of this, more so because of some of the stigma, don't know how to address or help friend. So how does this model kind of address those multiple pieces? And I know I kind of gave you a range, so but I was wondering, how does that model, and there are a couple different ones, address some of those pieces that come in from the community members or the communities we are trying to work with as prevention practitioners.
Right. I think it starts the conversation. So I think it's a really difficult, we haven't solved it yet, but I think it's a way to open the conversation that says, this is all of our problem, and there is something that all of us can do about it. And most communities will have local examples of when bystanders could intervene and did, and it was helpful, or when they didn't. And so that can also be a topic for conversation. And so I think built into a lot of the educational workshops, and certainly the work around social marketing campaigns and tailoring them for different campuses, is conversations within the campus with leaders, with community members, to say, how does it work here? What are some of the barriers? And what I've always been amazed by is that though the barriers are great, when you start to have those conversations, people will come up with the creative solutions. And especially, some of my colleagues have been really talking about the importance of doing this bystander work in smaller sub-communities because of how it really can bring people together and change some of the social norms. And what we know from some of the social norms research on this is that people across a variety of different communities tend to think that others are less willing to help than they are. So like a lot of other things, we tend to think that everybody else is not going to do anything, or that people are going to look down on us if we do. And then what we find is that actually people don't think that way. And so to the extent that some of our work also includes conversations about that, I think we can help people be more comfortable. And I think what also happens is that people feel like they might just be centered on one idea. Like they only have one idea about what they're supposed to do. And when they start to get in groups and when they start to actually have these conversations, they see that there are lots and lots of creative strategies and things that they can do. And that you can acknowledge that, you may not always be able to intervene in any situation. That if you're a bartender, there may be some moments when business is really busy, when you're not noticing things as much as other times. But if it's still in your consciousness, that's probably better than if you're not noticing it ever at any time. Do you know what I mean? Does that kind of help get at what you're saying? So I think there has to be a lot of conversation. This isn't just to take the program in a box and be able to translate it somewhere else. I think each community has to wrestle with this a little bit.
Right. And then I feel like with the curriculum that you have, and also actually there is a bunch of curricula and the social media pieces and the different pieces that are out there, we are able to kind of tweak some of that to kind of fit in the community. But I also want to kind of highlight, which you talked about a little bit, is to think about some of the applications, the smartphone applications that are out there. They really are kind of that additional piece that you can offer to the community if they want to. And one of the things that kind of come to my mind is the Circle of Six. And that's been really great as a resource because I know that they're doing some work with specifically with campuses. So if you are, as a prevention program, trying to reach out to the campuses and do some work, just know that these are some additional resources. There is no substitute to just building that knowledge. And as Vicki was talking about, like creating that space for discourse and kind of talking about some of the social norms and shifting our boundaries with the community. But the smartphone applications are really great ways of providing community, be it the campus, be it in a school setting, those additional tools that they could use. And I feel like things like Circle of Six really allows you to kind of connect with your network and have them come in and interact with you as you need that help. So I do want to flag that as well. I wanted to quickly check in and see if there are any questions from the participants. We do want to wrap up the conversation, but if there are any quick questions, we are happy to field that as well. Victoria, did you want to just leave us with a quick last-minute comment as participants are thinking about any last question for this webinar?
Yeah, I mean, if people have additional questions and ways that I can be helpful, my email is up on the slide right now, so you can feel free to email me. Also, there are some helpful things that I've written or that my colleagues have done. If you just Google Prevention Innovations at the University of New Hampshire, you'll find us, and you can find a variety of helpful things there. And happy to do what I can. And I know, Saswati, your email is up there as well, so folks can contact you. So I think just to encourage folks to continue the conversation.
Oh, thank you so much for that. Yes, I mean, definitely feel free to send us your comments, your questions. We really wanted to keep this webinar to an hour because we know that we are all so packed in our days, but we wanted to share this information with you. But we want at the same time to keep this conversation going. So if you have any question that you haven't had a chance to ask, I would encourage you to send me or Victoria an email, and we would be happy to work with you and see how you could use some of these tools in your own community and make it useful for the specific context or setting you're working with. With that, I really want to thank all of you. And Victoria, thank you so very much for this really informative and helpful webinar. I felt like I learned so much from just being here for the last hour. So thank you so very much, and thank you all of you for participating in the webinar. As soon as you come out of the interface, it would give you evaluation. So we would really appreciate it if you could take a minute and then take the evaluation and let us know what you thought and what your feedback is. We really value that input. So thank you so very much. You have a wonderful rest of the day, and we will be in touch with more information and a recording of the webinar. Thank you.
Thank you so much. Bye-bye.
Bye-bye.